Preoperative and postoperative care. Preoperative. Surgery interrupts the natural physiological processes of the body, and it causes stress and increases risk for complications. Variables that affect surgery would include the procedure performed, the age, and coexisting medical conditions. We know that in clients that are over the age of 70, they're at an increased risk for surgical complications. Older adults may also respond differently to anesthesia and drugs used with surgery, and they may also take longer to awaken from anesthesia. Clients that are overweight or underweight also require special care if surgery is indicated. Underweight clients may have increased problems with wound healing and infection, and overweight clients are going to be more likely to have respiratory and wound complications. We know that adipose tissue has poor perfusion, so the healing process will be slower, and that adipose tissue actually holds on to anesthesia longer, so the overweight client may remain sedated longer. There's several different types of surgery. We have diagnostic surgery, which is completed to make an accurate diagnosis through removal and study of tissue, or maybe opening of a body cavity to determine the extent of a disease process, and it may be performed through the use of a scope. Exploratory surgery would be a more extensive diagnostic surgery. Curative surgery involves removal of the diseased tissue, replacement of defective tissue to restore function, or to repair wounds. Palliative surgery is performed to relieve symptoms or improve function without correcting the problem. Cosmetic surgery would improve a client's appearance. Preventative surgery would remove non-cancerous tissue that has a high probability of becoming cancerous. Reconstructive surgery would be done to restore structure. And procurement would refer to the removal of organs for transplant. Surgeries can be completed in a variety of settings other than inpatient hospitals. Ambulatory or outpatient surgeries are increasing because of the advanced surgical techniques and anesthesia. Reimbursement, managed care, changes in Medicare, all of these allow a client to be discharged within a few hours or the following morning. Nursing goals would be to minimize the client's anxiety. We need to help prepare them for surgery and monitor for complications during surgery, in addition to assisting in an uncomplicated recovery. There's 3 phases: preoperative, intraoperative, and postoperative. The preoperative phase will begin when the decision to perform surgery is made and will continue until the client reaches the operating room. The intraoperative phase will start when the client reaches the operating room and ends when the client is admitted to the recovery room. And then the postoperative phase is when the client is admitted to the recovery room until the client comes back for the follow-up appointment with the physician. Depending on how soon a surgery is to be completed, nurses might only have a very short period of time to complete their nursing assessment. The assessment should include completion of preoperative labs and diagnostic studies, a review of the preoperative instructions with the client, including diet, skin prep, identifying risks that are related to age, their nutritional status, alcohol or tobacco use, and their physical condition. We also need to perform a history and physical examination and assess the client's understanding of surgery. Consider any special cultural needs that are based on beliefs, disposal of body parts, and blood transfusions. An informed consent, when complete, indicates that the client consents to a procedure and understands the risks. And in addition to the benefits of the surgery, it is required for invasive procedures that require anesthesia and has risks of complications. The criteria for a valid informed consent would be voluntary and over 18 years of age prior to any mind-altering medications. If an incompetent client or one that is cognitively impaired, mentally ill, or is neurologically incapacitated is there, then we have to withhold consent or obtain consent from someone who is required or authorized to provide that consent. Minor clients, unless emancipated, have to be signed by the parent or the guardian. Signature will require an adult witness, and the nurse is responsible to have that signed consent on the client's chart. Client teaching is going to be best accomplished during that preoperative period in order for the client to demonstrate appropriate understanding. Preoperative and postoperative medications may be included along with pain control, a description of post-anesthesia area and the routines, in other words, the recovery room. We need to also discuss the frequency of vital signs and monitoring equipment they might be using. We should also explain and demonstrate deep breathing and coughing exercises along with the use of incentive spirometry, splinting, leg and feet exercises. We should inform the client of any IV fluids or anticipated drainage tubes. We should also allow the client to express anxieties and fears, and we need to include family members in this teaching. We should also be aware of cognitive changes because of pain, medications, or changes in the environment. And we should use the teach-back method to help understand needs that need to be clarified. So, several days prior to surgery, the client may be required to bathe with a germicidal soap. Hair removal is not done unless it will interfere with the incision because of the potential of microabrasions. If necessary, the hair should be removed with electric clippers. The client may require the insertion of an indwelling catheter, or the client would void immediately prior to going to the operating room. Sometimes enemas or laxatives might be required to clean out the bowel for some abdominal surgeries to help prevent contamination. The client should be NPO at least 8 to 10 hours prior to surgery, although some surgical procedures might allow for clear liquids up to 2 hours prior to surgery. Postoperatively, we would encourage an adequate intake of protein and vitamin C to help with appropriate wound healing. Do understand that there are some medications the client must take. Sometimes the antihypertensives, especially the beta blockers, are supposed to be taken prior to surgery, and they would be taken with a small sip of water. The client's valuables should be left at home, but if they're not, if possible, we give them to a family member or significant other, or we place them in a safe. If a ring is unable to be removed or the client is reluctant to remove the ring, we would wrap gauze around the ring, or we would place adhesive around the ring. Glasses or contact lenses should be removed. The client will generally wear a hospital gown and a cap to cover their hair. The cap keeps the hair from floating around and potentially contaminating a wound. All makeup and nail polish should be removed. If it is an ambulatory surgery, only portions of the clothing, makeup, or polish may need to be removed. And anti-embolism stockings or elastic wraps may be required postoperatively or preoperatively. Dentures and artificial limbs should be removed prior to surgery, although sometimes dentures might remain in place until the client is actually in the operating room itself. There are several different types of preoperative medications. They can include anti-anxiety medications, histamine 2 receptor antagonists, anticholinergics, um, opioids, neuromuscular blocking agents, sedatives, or even antibiotics. Make sure that you follow the patient's rights for medication administration, and you're checking for drug allergies and you're checking their vital signs, etc. And the client should remain in bed with the side rails up for safety. If they receive some type of sedative or medication that is going to alter their thought process, making sure that the call button is within reach. Psychosocial preparation would begin as soon as the need for surgery is determined. Preoperative teaching and listening can help allay fears and anxieties. It is important to assess the client's coping methods. We might need to contact religious sources, clergy, or the chaplain if it's requested. A preoperative checklist can help assure that all preoperative needs and procedures have been completed. The nurse would assess completion of that checklist. We also would place emphasis on the right procedure at the right site. The client should be involved in that process whenever possible, and not necessarily marking the procedure site, but being awake when the procedure site is marked. And prior to the actual surgery beginning, a timeout would be initiated in the operating room with all members in the operating room being involved to make sure that the right procedure, right site, etc. is being done. So a surgery which the client will not be harmed if the surgery is not performed, but is going to be beneficial if it is performed is called what? Emergency surgery, urgent surgery, elective surgery, or required surgery? The correct answer is elective surgery.